Good afternoon, everyone, and welcome to a COVID-19 briefing from the Rath Building. Of course, I'm Erie County Executive Mark Poloncarz, joined by Karen Gambino from Deaf Access Services today. We'll be providing the American Sign Language. Apologize for not having an interpreter yesterday. It was just very, very short notice, but thankfully Karen was able to come here today. We're certainly going to talk about the announcement by the governor of the cluster zones. I did. Yeah, but I think we're okay. We're here, of course, to talk about the announcement by the governor today with regards to the cluster zones, as well as to give the most recent information. It'll be just myself with Karen Gambino from Deaf Access Services. Before we go into cluster zone, I want to give a little update on where we are and why we're in the situation we are today. There are now 19,151 total positive cases through yesterday. Yesterday alone, there were 516 new cases in Erie County out of 7,451 case reports that were provided to the Department of Health, which turns out to be a 6.8% positivity rate. Confirmed through yesterday is now 758 people have died. We've seen a number of deaths in the most recent period. We have a confirmed amount of 758 through earlier yesterday. If there were others that came through in the afternoon and the evening, they'll still be confirmed. But unfortunately, we have had quite a number of people die in the most recent period. These are all lab confirmed cases, of course, and there's no presumed positives. Each of these individuals had COVID-19 at the time of their death. On November 16th, there were 185 individuals admitted to Western New York hospitals for COVID-19, 150 of them in Erie County. We, of course, seen rapid increase in hospitalizations over the last week to 10 days. Of the 150 from Erie County, 32 of them were in the ICU and 11 had an airway assist. Here is the data for Erie County as of the 16th. Steep increase in hospitalizations over the past week. And the latest data shows nearly 50% of all patients are 64 and under. It was actually 47%. So the individuals who are in the hospital are not just the elderly. And you can see it right here on this the graph, which shows the breakdown by age ranges. The age range that had the most patients hospitalized was 55 to 64 on November 16th. So this is not just older people coming from senior homes that are actually going to the hospital. There are a great deal of individuals, actually, as you said, 47% under the 64 and under, who are being hospitalized, and the number one age range is 55 to 64. Here's an example looking at Western New York's hospitalizations. As you can see, the rapid increase in the last week after we had a steady incline for literally 2 to 3 weeks after basically months of being fairly stable. The diagnostic test criteria, we still have people who are calling. We just want to remind everybody there are many locations that you can get a COVID-19 test. Erie County Department of Health is testing those who are symptomatic or those that are close contacts of individuals who tested positive. It is free. You do not need an insurance card. You do not need a doctor's prescription, but you do need to call us and set it up, 716-858-2929. There are also dozens of other locations across Erie County to get tested, but these are all by appointment only. So now let's talk about the cluster zones. Earlier today, I had a long conversation with the governor, the lieutenant governor, and key members of the governor's staff as we talked about where Erie County was. We went through the positivity rates, the rate of infection growth in our greater community. A determination was made that we had to put a good-sized portion of Erie County into the orange zone, and the remainder of Erie County would be in the yellow zone. So everything that was previously in the yellow zone has been turned to orange based on the rapid increase infection rate, and also the towns of Eden and Evans, because we've seen spin-off and growth primarily from what is the highest part in our entire community, the town of Hamburg. So orange effective, and I want to say before I begin this regarding the towns, for the business community and the businesses that are affected by the orange zone, and for the communities that are in yellow that will be affected by it, this takes effect as of Friday. For schools, it takes effect as of Monday. So there is a little bit of delay for schools, and they are giving businesses, the ones that are affected by the orange zone, the remainder today and tomorrow to continue to have in-person service. And we'll go into what that means a lot more. But the orange zone includes the city of Buffalo, the city of Lackawanna, the city of Tonawanda, and the towns of Amherst, Aurora, Cheektowaga, Clarence, Eden, Alma. It should say on there Evans. It doesn't, but it should. Evans, Grand Island, Hamburg, Lancaster, Orchard Park, the town of Tonawanda, and the town of West Seneca. So everything that was yellow previously is now in the orange, including the towns of Eden and Evans, as you see on the screen, and was released by the governor earlier today. Yellow is the rest of the county. Alden, Boston, Brant, Colden, Collins, Concord, Holland, Marilla, Newstead, North Collins, Sardinia, and Wales. A lot of people say, well, you didn't talk about my village. We don't reference villages, we talk about towns. So if you live in the village of Williamsville, you're going to be affected in the orange zone because you theoretically are in the town of Amherst, but you could also be in the town of Cheektowaga. So if you live in the village of Akron, you are in the town of Newstead. So then you would, of course, fall in the yellow zone. This is effective, once again, for all businesses Monday. So as of close of business Thursday, Monday it would take effect. And for schools, it takes effect, or excuse me, close of business Thursday for businesses, it takes effect on Friday morning. For schools, it takes effect on Monday, so the next school week. Now, there are a lot of things that are covered by the orange and yellow zone restrictions. We've talked a lot about the yellow zone restrictions because of the sizable portion of Erie County that's been in the yellow zone for a little over a week now. And then the orange zone. So let's start with what's in the orange and what's affected. You cannot have non-residential gatherings of more than 10 people, indoors or outdoors. The same goes for residential gatherings, no more than 10 people. If you are in a yellow zone, if it is a non-residential gathering, so it's a meeting, let's say at a location, you can have 25 people indoors or outdoors. If it's a residential gathering under the new statewide rules, no residential gatherings can have more than 10 people. With regards to houses of worship, if you are in the orange zone, it is the lesser of 33% capacity. Make sure I read that right. Yes, 33% capacity or 25 people, the lesser of. And for a yellow zone, it is 50% capacity. With regards to businesses, there are certain high-risk, non-essential businesses that have to close effective Friday in the orange zone. In the yellow zone, they can stay open. And I'm going to go into that in greater detail because it's a little bit more than what people had heard previously. But it's all high risk as determined not just by the New York State Department of Health, but by the CDC. Dining. Everybody wants to know about dining. Outdoor dining, delivery, and takeout is still allowed for all bars and restaurants in the orange zone. You cannot have indoor dining. Yellow zone, you can have indoor dining as well as outdoor dining, but you're limited to no more than 4 people per table. So in the orange zone, restaurants and bars can no longer have indoor dining. They can have outdoor dining. It's limited to 4 people per table. Yellow zone, they can have indoor dining and outdoor dining. It's limited to 4 people per table. And then schools, the schools are to be remote except they can test out. And there'll be more information that is going to be provided to the schools very soon. The Lieutenant Governor and I were very adamant about giving the schools an opportunity to test out if they so want. The testing restrictions are not easy to meet, but they will have an opportunity to test out. Otherwise, they must go virtually. Now, this is different, of course, than in the red zone, where pretty much everything shuts down, including the schools, businesses, houses of worship to an effect, and no gatherings. So we're not in the red zone. It's highly possible some of the regions could have gone in the red zone, but they would have been so detailed. In some ways, it would have been unfair that one street would have been shut down, but the next street might have been open. So we felt it was best to ensure that we reiterated the dangerous situation that we have to try to stem the tide with regards to the growth of the coronavirus and COVID-19 cases. So a vast majority of Erie County, as I mentioned, is in orange. The rest is in yellow. And also the city of North Tonawanda in the county of Niagara has been added to the yellow zone. There was very much worry about the growth in cases in North Tonawanda, and considering the amount of cross-border shopping and dining that goes on in the new cases, the governor's office informed us that it was important that they also included North Tonawanda in the yellow zone, even though it is not in Erie County. Now, the microcluster orange zone, it is very detailed as to what must close effective Friday. It is higher risk businesses associated with the transmission of COVID-19 viruses, including gyms, fitness centers or classes, barbers, hair salons, spas, tattoo or piercing parlors, nail technicians and nail salons, cosmetologist, esthetician, the provision of laser hair removal and electrolysis, and all other personal care services shall reduce in-person workforce in that area by 100%. So we wanted people to understand this is directly from Governor Cuomo's Executive Order 202.68. So this is not myself making it up. This is what's been in place with regards to the cluster zones for the orange zone. We did not put the red zone up here because if it was, pretty much everything would be shut down except what are considered essential businesses. And we don't want to go in the red zone, so we don't even want to talk about that. But we believe that it is important that the public understand who is affected as a business or an entity by this. It is generally locations where there are multiple people working together on the people in the public who then would travel in and out among the community. So it affects, once again, those that have a higher risk associated with transmission of COVID-19 virus as determined by the Department of Health for New York State and the CDC, which includes gyms, fitness centers or classes, barbers, hair salons, spas, tattoo or piercing parlors, nail technicians and nail salons, cosmetologists, estheticians, and the provision of laser hair removal and electrolysis. So if you are in that business, you can finish your work today, you can complete whatever appointments you have tomorrow, but then on Friday you have to stop the service under the orange zone order. New York State, Erie County will be enforcing this to our bars and restaurants. You can still do takeout, you can still do delivery, and you can still have outdoor dining up to 4 people in the orange zone. You cannot have indoor dining anymore. I know, and having been to a restaurant this past weekend, they were very concerned. We're all very concerned about what we're seeing, but we're seeing rapid growth in cases, rapid growth in hospitalizations, and now we're starting to see rapid growth in deaths. And none of us want to deal with that. I know people who died in the last week, not family members, not dear friends, but people I have come in contact with over the last few years. And I know that that's another family that's going to have one less seat at the table for Thanksgiving. And to bring that up before we take questions and answers, just like Governor Cuomo said, and I posted earlier today on social media, we need to learn from what happened to our neighbors to the north and west, depending where you are, in Canada. They had their Thanksgiving in October. Their Thanksgiving is always in October. They saw a big spike in cases and hospitalizations as a result of people gathering for Thanksgiving. That is why we are recommending that you do not have your normal Thanksgiving except with your immediate family members. So if you like watching the football games with Uncle Charlie, and you go over to Uncle Charlie's house, and Aunt Viv's, or of course Aunt Ginny, don't go to their house. Stay home. Watch the football games at home. Have the dinner with your immediate family. The Canadian experience showed that there was rapid spread of the coronavirus and COVID-19 cases from individuals who went to family and friends' house for Thanksgiving. Let's learn from their experience. This is not a war on Thanksgiving. We want people to have Thanksgiving. We also want people in 2021 to be around at the dinner table for that Thanksgiving. We hate to see the stories that come out of an individual catching COVID-19 from a family member who either didn't know they had it because they were asymptomatic, or just had like what they thought were the sniffles. Our Commissioner of Public Works, as it was revealed yesterday and is in today's paper, William Gary, is dealing with a mild case of COVID-19. It's so mild, he thought he just had just a stuffy head, but he couldn't taste or smell anything. He got tested, he has COVID-19. So Bill is in isolation at home, still doing work through the computer, and we wish Bill Gary and anyone else who's dealing with COVID-19 a quick recovery. But if Bill had not known he had COVID-19 and he visited a family member, he could have passed it on to that family member. That's why it's so important that with Thanksgiving coming up next Thursday, you please have Thanksgiving with your immediate family. Do not go to your fellow family members or friends that you normally would do, because there's a very good chance that you're going to be putting them in risk or yourself at risk, and nobody wants to do that. So I will now open it up to questions from the media, but once again, we just want people to understand this is a very serious situation. As the governor noted today, unfortunately, our area, Western New York, is the worst in the state. Erie County and some of the areas in Erie County are the worst in the state for positivity rates. We had hoped that this wouldn't happen, but it has. And now we have to address it. None of us want to do this, but we have to do it because this is not about politics. It's about saving people's lives. And I know we're going to lose more people over the next few days and weeks, but we need to do the best possible to reduce that number to the lowest level it can be. So please, please, I'm imploring you, follow the rules. I'm not going to be spending Thanksgiving with my parents nor other family members, and I ask you to do the same. With that, I'll open it up to questions. We will start on the list here. Is there anybody from Channel 7 WKBW? You need to unmute yourself. If you're mute, that's *6. If not, we will go to...
Can you hear me?
Sure, go ahead.
Well, the governor having some pretty interesting words for Western New York in particular, saying that we've never lived the full pain of COVID's wrath. I think that, some people might be offended by that who have lost loved ones. What's your take on that?
Well, I certainly agree with you that we know that unfortunately more than 750 people have lost loved ones, and we always offer our deepest condolences to them. I think he was comparing it to New York City, in which it was just horrible, absolutely horrible. Captain Sean Lavin from the New York National Guard is actually an employee of Erie County, and he was the one that was responsible with his team for the body pickup from the homes. And I've heard the stories from Sean. It was absolutely horrendous. And I think the governor was just talking about a comparison of what New York City and downstate was dealing with. And we did not deal with that. But that doesn't and shouldn't limit the pain that people in our community have felt because of the loss of a loved one or someone who's dealing with serious after effects of COVID-19. And on behalf of myself and the people of Erie County, we certainly want to offer our deepest condolences to those who've lost loved ones. Let's hope we never have to deal with what New York City did. We have a cold storage trailer for bodies in Erie County. We thought we were going to have to use it. We came really close to using it to the point we had 2 of them at the ready. We never had to use it. We still have a cold storage trailer, basically a mobile morgue at the ready if need be. Let's just hope we never have to do it because we follow the guidelines. WIVB Channel 4, Chris Ravadas, Dan Telvach.
Hey, Mark. A couple questions on a couple different points. First, I've been looking at the numbers over the past 48 hours, and I think I'm just surprised that nothing went red. I'm wondering if you share in my surprise that the worst we have is an orange zone.
Well, what you have to remember is we're looking at 7-day rolling averages of positivity rates, plus the impact on our hospitals, plus what is the impact per zip code or even down to the census tract block with regards to rates per 100,000 residents. And while there is possibility that some red zones could have been implemented, as I said, it would have been here's a red zone in this part of the town, but not the rest of the town. Here's a red zone in another part of town. We felt it would have actually just caused additional
Fair enough. Can you clarify something on schools also for me? So it takes effect on Monday, so I take that to mean that schools can remain open through the rest of this week. And then the way the state says it is that schools have to close for at least 4 days, and if they conduct mass testing, the earliest they could reopen is on the 5th day. Does that mean that schools would, no matter what, have to be closed in the orange zone Monday, Tuesday, Wednesday, Thursday, and that next week, Friday, if they conduct that mass testing, would be the earliest they can reopen?
That is what the cluster zone rules say. We are trying to get some further confirmation from the state as to whether or not they would give them a little bit more time to do testing. The one thing we have seen recently an uptick in is school-to-school transmission. We are seeing that. So beforehand, where it was, well, there's no transmission between students and teachers and vice versa, we are starting to see that. We're seeing more school-age children who are testing positive, including those who are asymptomatic, but may got tested because their parent was sick. So you are correct with the description, though I'm waiting for a little bit more guidance from the state to determine if they'll give them a little bit more time to do that intense testing, so to speak. I know a lot of school districts have already gone virtual. The media's been talking about it, and it would not be surprised even after this announcement, even if they're given a little bit more time to do testing, that others will go virtual. It is concerning, especially considering we are now starting to see school-to-school transmission, or student-to-student, student-to-teacher, teacher-to-faculty member. So it is definitely occurring, and it is something that we have to stop. Otherwise, we are on a road where there's a cliff, and you see what's happening in the other states, and I do not want to drive our community's communal bus, so to speak, over the cliff. WGRZ Channel 2. Is anybody on from Channel 2?
Hi, this is Claudine.
Hi, Claudine.
Regarding enforcement, with the numbers going up, what's the enforcement going to be like to make sure that, number one, these places are definitely shutting down and people are following the rules?
There'll be enforcement from the county, there'll be enforcement from state agencies, and of course, there has been recently enforcement from local law enforcement to ensure bars and restaurants were closing at 10 p.m. We don't want to make it seem like we're penalizing one industry. We know businesses are going to feel that way, but there is, and been seeing, spread in some of these locations, and we have an opportunity to control it. So the county will be enforcing, as we always have. The state is sending in, and has been sending in, extra staff from the State Liquor Authority, the State Department of Taxation and Finance inspectors, as well as those from the Department of Health inspectors, who are doing a lot of enforcement mechanisms in nursing homes from the state. And they're even sending in the agricultural department inspectors, which have a responsibility to ensure that supermarkets or anything that has like a meat and produce actually is following the rules as well. So you're going to see that same level that we've seen in the last week with regards to the county and the state, as well as increased inspections from building inspectors as well as law enforcement to ensure that these entities are following the rules. We've sent out a lot of folks over the last week and a half, 2 weeks, in addition to what we were doing beforehand, and going into the late night hours, having overtime, so they're going out and even at midnight hours to see who's open. Barber shops, we were noticing that barber shops, there were a number of them, especially in the city of Buffalo, where the clients were not wearing masks, or worse, just as bad, is the barber was not wearing masks. They were cited for the violations. We did find some restaurants that were not following the rules, even with regards to kitchen staff and others. So even after all this time, there still wasn't following the rules, and we've been citing them. First time violation gets a warning. Second time gets a fine. Multiple ones that can get shut down. And we'll be continuing to go to those locations that we went to in the past, doing spot checks. You never know when it's going to come, but we're going to do those. Spectrum News, any questions from anyone on Spectrum News?
Yeah, hi Mark, this is Erin. We're just wondering, what does this mean for shopping malls? And obviously it's the most busy time of the year for people to go out and go shopping.
Shopping malls are still allowed to be open, as are all retail establishments. They have to follow the capacity guidelines as if they were in phase 4. So they still have to have restrictions on the number of individuals. It's a 50% capacity. So if you have mass people in the shopping mall, we're going to have to shut them down if they're crazed like they are during the Christmas season, because they have to be at 50% capacity. And the mall owners are responsible for ensuring that they're not allowing more than the capacity allowed in their facility. Same thing with the retailers. If the capacity in the store is 250 people, and we come in there and we see 200 people in there, we have to shut them down until they go to 125 customers. So they're still allowed, but they're not free reign. They just can't do whatever they want. They have to follow the rules as in phase 4. And if they don't, they will get shut down. And if we go into the red, they have to shut down for in traffic walking in, and everything would have to be by curbside pickup. Buffalo News, Sandra Chan.
Yes, hi, thanks. Just to clarify again, if you are in the orange zone, your school in the orange zone, you can test out of remote learning, but there's still some sort of lack of clarity about, what the timeline for that would be. And my other question on this is, the governor mentioned 5 specific communities with high spread in his presentation. Was there any conversation or any efforts to suggest that perhaps only those areas move up into the next, into the orange zone instead of the entire orange region as it is now?
The first question, in regards to the first question in the schools, you're correct. I believe more guidance will be coming to the schools in the next few days. I understand everybody wants to know the immediate answer. The schools have an opportunity to test out. It wasn't always that way, but they now have an opportunity to test out in the orange, and they certainly have an opportunity to test out in the yellow. That information will be coming from the state in the next day or two, hence why it's not even applicable to the schools until Monday. And with regards to the areas even the governor noted particular towns, and there are areas of concern in each town that are much higher than other areas. And if you do the microcluster, as is done in some of the other areas, including Brooklyn, where they shut down just neighborhoods, but didn't shut down all of Brooklyn, it would have generally, the thought would have been, if you kept an indoor dining portion open in one portion but not in the other, people would flock to the other location. And if you shut down all retail, like I gave the example, in a portion of, say, on one side of Niagara Falls Boulevard, but you kept the other side open, it would cause lots of confusion, and truthfully, we felt lack of following of the rules if it was so arbitrary. We've been looking at, and they've been looking at, even down to like census blocks to try to determine where these cases are coming from. And if it was specifically associated with a nursing home outbreak or something with an employer, we could say, all right, we're going to lock down that area there. But it's not. Good example was the town of Hamburg. Town of Hamburg, over 200 cases in the most recent week. It doesn't include the most recent days. But I know that when it comes to the nursing home cases, it's not that many new nursing home cases. The cases are elsewhere, and they're throughout the community. And when we talk about 14075, we don't take into effect 14219, which is Blaisdell, or 14085, which is Lakeview. And when you look at those, you'll see, even in those zip codes, you'll see one part of the zip code very high, another one maybe not so bad. So if we actually did that in the reds, you would have had dots of reds and little strips of reds throughout the whole orange section, including multiple potential ones in one town, but it would have been almost impossible to enforce. So the decision was, orange is pretty strict as it is. If you're a restaurant or a tavern owner, you're not happy right now because the indoor dining that you've been able to provide has to close. And we're really trying to do our best to not shut down the economy. As I've said before, economies can recover, dead people can't. But we also don't want to destroy our economy such to the effect that we don't ever recover. I remember what it was like in the 80s, and it was horrible. It took decades for the community to get out of the economic doldrums of the early 80s. And we never want to go back to that situation. But we also have to do what's in the best interest of public health, which is ensuring that we move forward with a strong, comprehensive plan that allows us to address areas of concern, which unfortunately, for as it pertains for Erie County, is more macro cluster in nature.
So if there were some areas that could move into the red zone, would you recommend that for the entire region?
No one recommended moving in the entire region into the red zone at this point. No one did. Okay. Whether it was the governor, the lieutenant governor, or myself, we we all feel that there's certain actions that need to be taken. And after conversing as earlier today, the long conversation I had was with the governor, Lieutenant Governor Melissa DeRosa, the governor's secretary, who you often see with the governor during his press conferences, Gareth Rhodes, often see with the governor's press conferences, Kara Griffin, the director of intergovernmental relations, local government relations, and I believe Beth Garvey, the operations director for the state, was on. And that's after multiple calls I've had over the last few days with lots of folks, literally testing back and forth with data points with the governor. So it's fair to say that this was not a decision that was made lightly. It was a comprehensive review. No one wants to go in the orange zone. I don't really want to go in the orange zone. It's going to make a lot of lives miserable and people without an income for some period of time. But we have to stem the tide of the increasing cases, the hospitalizations, and the deaths. WBFO, Mike Desmond. Michael, you need to mute yourself if you're still on, *6. We'll move on to WBEN. Is WBEN on? Okay, is there any other media entity that I had not identified?
Hey, Mark, it's Ethan Powers from the B News.
Hi, Ethan. Go ahead.
Hi, thanks for taking questions. I just wanted to get some clarification on the school testing mandate. You've said multiple times over the past few weeks that it's up to the school districts themselves to obtain the testing materials from the state. But I spoke earlier this week with some school superintendents who said that the Monroe County Health Department ordered tests for all school districts and distributed them. And I was just wondering if you have any indication as to why there seems to be a difference between what the school districts expect from Erie County and what the county is actually able to provide.
The school districts are able to order directly from New York State. It will probably be shipped to our warehouse in which we will distribute it then, testing kits, but they've been provided the information. There's a huge difference between Erie County and our testing lab and every other testing lab in New York State, except for the New York State lab and the New York City lab. They're called, the other counties and everything else are called limited service labs. Erie County does not have a lab that's actually qualified by New York State. We have one of the few labs that's actually qualified by the CDC. We have one of those labs that you see in the movies where the people, there's the clean room, only a certain people can go in it. They have to wear the full body suit. They look like they're astronauts walking in. I think there's only 3 people who are actually qualified in Erie County to do that. I can't go in the room, got biometric entry ports. And that's because we're a CDC lab, which means we have to meet CDC qualifications on all tests that run through our lab. And that's why we do significant testing for our testing clinics. Everybody who's an EMT and so forth has to go through stringent testing as well as guidelines where we're overseeing all those tests. And we're not a limited service lab like the rest of the counties have. Niagara County does not have a CDC-approved lab. Chautauqua County doesn't. Monroe County doesn't. Actually, there's no other county that has a CDC lab in New York State. And because of the issues associated with it, we cannot oversee and be responsible for tests that we're not watching, that we're not actually performing ourselves. So we will allow, of course, if the school districts order testing kits through the state, it comes to us, we'll distribute it out to the state or the school districts through our warehouse. That is something we will do. We will take the results, we will put them in the eClair system, but they have to have their own limited service license. It's a different comparison. I've been in our lab, but I can't even get into the clean room sections. I can't, as county executive, I'm not allowed in. Dr. Burstein's not even allowed in because of the stringent requirements associated with our lab. There's a portion of it which would be similar to what others have, and then there's a whole other portion that's not. And we have to be able to meet the qualifications with the CDC lab. Otherwise, we lose our accreditation. And we do not want to lose our accreditation. It is a huge impact for us. I know people find it, well, why are you different than everyone else? Decision was made a long time ago. We should be proud that Erie County is one of the only CDC labs in all of New York State, because there's only 3. New York City, the New York State lab in Albany, the Wadsworth lab, and Erie counties. But we will not be able to perform all and analyze all the tests, though if the school districts order through the system that they've been provided, it's just an email. They order it from the state, It will be shipped to our Erie County warehouses and will be available for pickup once we have it.
Great, thanks, Mark.
You're welcome. We'll go through one more round. Is WKBW? If not, WIVB? Any more questions, Chris or Dan?
I'm okay, Mark. Thank you. I'm not sure if Dan is on.
Okay. WGRZ, Channel 2?
We're good for now. Thank you.
All right. Spectrum? I think there was anybody on earlier.
Yeah, one more
yes, Erin.
question. What does this mean for the virtual learning centers that the county set up? Do they have to close as well with the Orange Zone regulations?
Thank you, Aaron, for that question. The virtual learning centers do not have to close. They are not considered schools. They are still open. They were at about 60% capacity countywide. They can still accept more. We are following stringent guidelines with regards to ensuring the safety of the virtual learning centers, but the virtual learning centers are still open. If you need to put your child into a virtual learning center, we still have openings, and we ask that you contact your school district because there are different virtual learning centers in each of the school districts. Every school district has a virtual learning center. They're run by different entities, but we ask if you need to put your child into a virtual learning center, they will still be open. They are operating under stringent guidelines with regards to providing the child care, so to speak. They're not schools. They're basically child care agencies in which they ensure that the children are at least getting their study done virtually. But they are still open. Talk to your school district if you need a virtual learning center. Sandra, do you have any more questions, Buffalo News?
Yes. In regard to contact tracing, we heard from Dr. Burstein this morning that they are still behind in terms of bringing contact tracers on board because of all of the training that's required in order for them to get started, not only with the general contact training principles itself, but also the software system they're using. And we're also hearing from folks who are saying they're waiting up to a week to find out that they've tested positive for the virus. So I'm just wondering if there's any update on where that stands and how soon contact tracers might be able to get answers back to people, especially if they test positive more quickly.
Well, the problem with them waiting for a week and testing positive, and we've heard that too, and we've often reached out to some of those people and we find out they're not getting their test done by the county or the state. There's still delays.
That includes some folks who are getting tested by the county.
Yeah, we have a 36 to 40 hour turnaround right now on testing from the county. And I have no one. Now, I could say it, I'm not going to say it didn't happen, but my understanding is it's basically a 36 to 40 hour turnaround from when the test was taken, the test was done, and when the person is notified of their positive or negative results. I have heard plenty of complaints about, I went to this private lab, I went to my doctor's offices. I've heard of that, and we understand that those delays still exist. On the contact tracing, we are still in the process of training more individuals. We're looking at also doing more virtual, which in other words, contact tracers don't have to work in a particular location, so that we could bring theoretically more people on and have them spread out across the county, including potentially even working at home. That is all part of it. And we're also relying on New York State and the CompCare contact tracing system to handle some of our cases. It is a lot. We're catching up. I've authorized overtime to contact tracers. I've authorized the hiring of more contact tracers. It's not from a lack of saying, oh, we're not going to spend our way. We're just going to forget about it and I'm not going to worry about it. We're addressing this issue. We are, as you can say, I said over 500 new cases from yesterday alone. We literally went from having 400 cases a week to 400 cases a day in 2 weeks. And it's exceptionally disappointing and distressing. And we're going to work on it to the point where we are back to where I feel we should be. I'm not happy about it. I'll be the first to admit. We have policy calls internally among the county representatives, finding out exactly where we are. And Dr. Burstein knows I'm not happy about it, that would be any delay more than 24 hours for contact tracers. And I've authorized appropriate action so we can reduce that lag to the best it's possible.
Okay, thanks.
WBFO, are you on, Mike Desmond? WBEN? Ethan Powers from B News. Do you have any more questions? If not, I want to thank everyone for participating in today's briefing with regards to COVID-19. This is not a fun time for anyone, I agree with that, but I would ask everyone to count themselves lucky if they have not lost a loved one or have a family member or friend who's very sick in a hospital right now. We have lost too many of our fellow county residents in the last period, much more rapid growth in deaths, and unfortunately we do anticipate that that will continue for some time. That's why the governor and the state implemented the micro-cluster strategy, with the whole county being at least in yellow and a good portion of the county being in orange. I take no joy in this. I also take no joy in having to read the reports of deaths on a daily basis, knowing that those are loved ones, including younger people who were planning on holiday gatherings, were planning on being at their family's house for Thanksgiving or Christmas or Hanukkah or Kwanzaa. And now their families are going to be in immense pain as they've lost a loved one at a period when we could have stemmed the tide, but for some reason this community, we just weren't able to do it. We have to do it, folks. We have to be better. When you're out, wear your mask. If you've got it, bring it with you. Bring your hand sanitizer. I bring my hand sanitizer everywhere. I do go to supermarkets still. I get in there, I'm bringing my hand sanitizer, and I'm cleaning off the cart. We've got to be smarter about how we do it. We love getting together and watching the Bills. It's fun when you do that. But we know that there's transmission between individuals who are attending Bills games parties. Thanksgiving's coming up. Please, I am imploring you, do not bring together people you haven't been around. Have Thanksgiving with your immediate family. You want to be able to celebrate future holidays with your family members and not have that empty seat at the table like too many of our fellow residents will have in the next years because of what happened with regards to COVID. So once again, on behalf of all of us, please follow the rules, wear your mask, be a good neighbor to each another. We wear our masks not only to protect ourselves, but to protect our friends, our family, and even people we don't know. And if we do that, we will all be better for it. I wish everyone good tidings, be well. We will, of course, have a more comprehensive report tomorrow, as we are going to bi-weekly on Monday and Thursdays. So we'll be providing more data tomorrow with regards to mortality and other information. But be safe, be well. This is the holiday season. Let's all get through the holiday season as best as we can by following the rules so that we can enjoy further holiday seasons in the future. Thank you, everyone. Thank you, Karen.